Hello there. I'm here with Nancy Gaden, Senior VP and Chief Nursing Officer for Boston Medical Center. Nancy, thanks for being here. We've talked a bit, and there's been a lot of focus on the pressure that's on acute care facilities all across our country as a result of COVID-19. But as I've been thinking about Boston Medical Center and our health system's response, I've been impressed that particularly the Department of Nursing, but many other people, are supporting our patients in a whole host of unusual places, like telehealth visits or screening outside of our emergency room, or our health plan making sure people have the equipment and supplies they need at home. Could you talk a little bit about how your team is working in different ways to support people through this pandemic?
Yeah, we've all seen the huge amount of disruption in all kinds of the sort of societal supports. And you started with a couple of examples, but I'll just start with the health plan. You know, people need a lot of things at home, and some of the ways that they would usually get those are not working as they usually do. And so the nurses are very involved in care management activities, really making sure that people can stay on the path of getting the durable medical equipment they need, or their pharmaceutical support, or whatever it is. So I think, and nurses are very creative, and nurses are able to pull all sorts of things together. So I think maybe some of the work that they do to pull together supports is maybe the best example of nursing, really. We do have nurses now stationed in the lobbies doing temperature checks and evaluating visitors and patients who come in for ambulatory visits. That's an unusual role for a nurse. They do have
stopping people from getting care.
Getting. That's a great point. Right. Yes, exactly. Working with the security people to make sure that we're moving people in the right direction. We have nurses. I think in the emergency department, it's been a very different ED, right? So we don't have as many ambulatory people seeking low-level care. We have more people coming in by ambulance as a percentage, many more than usual, and we have patients who are sicker when they get to us, I would say. And so the emergency department is also sort of faced with needing protective equipment, not knowing what the patient needs when they come in, and having to prepare for the worst, sort of. So, kudos to the ED teams who are always ready for anything, but especially in this COVID-19 tragedy, have been doing things differently. They set up a tent. They've been able to move patients who have some respiratory symptoms out to the tent and test them there. So I think we have nurses in the testing centers for employees. We have a lot of nurses working in the employee area, answering questions by employees on different risk factors that the employee might have or their family member might have. And in the primary care offices, where you would think that because of the decline in visits, there is a huge decline in nursing work, that has not turned out to be the case. Yeah. Right, because the nurses do a lot of work on the phone, and families and patients have a lot of questions. And part of what the nurses are trying to do is keep the patient from having to come to the hospital. So sometimes that takes a lot of negotiation with the family and patient on the phone. So I would say this has been it's a great time for nursing, actually, I will say, because it shows all the different ways that nurses can really contribute to people's health across the continuum.
Well, I want to thank you for creating an environment where nurses can really practice probably beyond the top of their license in ways that they hadn't even anticipated. And I want to thank you all for tuning in today.